Snoring children have a smaller brain. About 5% of all children have sleep disturbance. A study on sleep apnea and brain development of children between 7 and 11 years of age showed significant reductions of gray matter in several regions of the brains. It includes the brain cells involved in movement, memory, emotions, speech, perception, decision-making and self-control affected by disturbed sleep. The finding points to a strong connection between this common sleep disturbance and the loss of neurons or delayed neuronal growth in the developing brain. This extensive reduction of gray matter in children with a treatable disorder provides one more reason for parents of children with symptoms of sleep apnea to consider early detection and therapy. Leila Kirandish-Gosla, Director of Pediatric Clinical Sleep Research at the University of Chicago, is the study's senior authors. This study, published on March 17, 2017, in the journal Scientific Reports. There is clear evidence of widespread neuronal damage or loss compared to the general population in sleep-disturbed children. The researchers compared the MR images, plus neuro-cognitive test results, with healthy children, who did not have apnea. The images of gray matter changes are striking. They found reductions in the volume of gray matter in multiple regions of the brains of children with obstructive sleep apnea. These included the frontal cortices, which handle movement, problem-solving, memory, language, judgment and impulse control. The prefrontal cortices controlling complex behaviors, planning and personality. Parietal cortices involved with integrating sensory input. Temporal lobe, the seat of hearing and selective listening, and the brainstem, which controls cardiovascular and respiratory functions. Although these gray matter reductions were rather extensive, the direct consequences are difficult to measure. MRI scans give a bird's-eye view of the apnea-related volume loss of various parts of the brain. They don't tell us, at the cellular level, what happened to the affected neurons or when. The scans do not have the resolution to determine whether brain cells have shrunk or been lost completely. It cannot tell exactly when the damage occurred. However, it connects the severity of the disease with the extent of the cognitive deficits, when such deficits are detectable. For a child born with a high IQ, a loss of 8 to 10 points, due to sleep apnea may never become apparent. But for a child of average IQ, sleep apnea if untreated can potentially affect the learning. The exact nature of the gray matter reductions and their potential reversibility remain virtually unexplored. However, altered regional gray matter is likely impacting brain functions, and hence cognitive developmental potential may be at risk. This should prompt intensive future research efforts in this direction. Thank you.